Hello, and thank you for tuning in today. I have been meaning to record this episode for a very long time, and I don't know what's taken me so long. Actually, I guess other important topics were prioritized, but we're going to be talking about the concept of prehab, which is also called pre-habilitation. And it's something that is very common in the physical therapy world, but I've been discussing it recently and really over the last year or so with several of my missing link members and one-on-one clients, and no one has heard of it. And so I wanted to take this time to educate you on what it is, what you need to know about it and why it's important, and how it relates to multiple sclerosis. And not only that, but how it relates to your strength and your walking and your function and the ease of your day-to-day activities. Prehab is different from rehab. And the first thing that you need to know about it is that prehab is a proactive approach to maintain or improve function before decline occurs. And when it comes to multiple sclerosis, this can be kind of hard to wrap your head around. So I first want to discuss this as it pertains to an orthopedic injury, and then we'll come back to multiple sclerosis in a bit here. So if you think about someone who maybe has been having hip pain for years and their doctor finally says, okay, you need a hip replacement. More times than not, what should happen is this person should go to physical therapy before they have the hip replacement. And the reason for that is to get as strong as you possibly can before undergoing surgery. Because as we all know, once you have surgery of any kind, your muscles are going to be weaker after. For most orthopedic surgeries, your muscles are being cut through. I apologize if that's too graphic, but they are being altered. I'll put it that way. And so after surgery, they are weaker. They need time to recover and heal and get stronger. Prehab is the idea that you go to physical therapy before this instance where you know you're going to get weaker. So you try to get as strong as you can so that after surgery, you're starting off at a stronger point, and your muscles are going to have that muscle memory, and your neural pathways are going to remember how to do specific movements because you had previously practiced them. Once you have the surgery, then you participate in rehab, and rehab addresses the issues after they've developed. So in this case, it would be the weakness and probably poor balance and maybe even pain from the surgery. So typically the way it goes is prehab, then an event, like in this case, the surgery, and then rehab. Now, with multiple sclerosis, it is a little different because, as we all know, this is a chronic condition. And this truly applies for any chronic illness, even progressive illnesses. And more often than not, when you're diagnosed with MS, you weren't getting physical therapy for anything. More likely, it's that you were diagnosed because you were having symptoms, but not because you were going to PT and then that's when you realized symptoms. So when we're talking about multiple sclerosis, prehab isn't necessarily before the diagnosis. Usually you're diagnosed and then prehab begins. And what you are being proactive about isn't necessarily an event like a surgery, but an event of a relapse or an event of progression. So when we're talking about MS or any other chronic progressive condition, usually the way that it works is diagnosis, prehab, and then maybe that's it. And you just stay at the prehab phase, or diagnosis, prehab, flare or relapse or progression, and then rehab. And then it just continues in that cycle. And since multiple sclerosis is a progressive condition, Early intervention is crucial, and it works the same as an orthopedic injury. So, because you're going to be doing physical therapy before this potential relapse or flare or progression, you're getting your muscles and neural pathways stronger before any of that even happens. So that if you do end up having a relapse or a progression or flare, whatever it is, you're starting off at such a stronger point that hopefully you won't notice the effects of that flare or relapse or progression as much because you're starting off so much stronger with your muscles and your neural pathways. So, is it going to prevent relapses or progression? No, absolutely not. But you're training your body so that if and when those do happen, you're already stronger, and hopefully you won't notice the effects of it as much. So, for example, if that relapse or progression does cause weakness, you might still notice weakness, but not nearly as much weakness had you not been doing your pre-hab exercises. Prehab can help maintain function, delay progression, and also improve your quality of life because more likely than not, you'll be getting stronger, better balance, better walking. Whose quality of life isn't going to be better when those things feel easier and less cumbersome? But let's talk about the different components of prehab because it's not just exercise, but exercise is a big component. So, exercise would be things like focusing on strength training in your legs, in your upper body, your hands, your core. It also includes flexibility and stretching. It includes balance. It includes aerobic exercise. You can think about it in a way where you're thinking if you do have a progression, what are the possible body parts or areas or things that might happen? So, one possibility might be hand weakness. And if that's the case, and even if you have some hand weakness now, you can do prehab by strengthening your hand with hand exercises. Or maybe walking might be affected. So you can do prehab by strengthening the muscles that are responsible for walking early on during prehab. So you can get really specific like that where you're trying to do prehab for specific things or just generalized. You know that generally speaking, you want to keep your leg strength, your core strength, and your arm strength. So you just do strengthening exercises for those areas. Or you want to make sure you stay flexible and that spasticity doesn't affect you as much. So you're practicing stretching specific muscle groups, things like that. Same with balance. There's lots of different positions you can balance in. So doing those things proactively before a relapse or progression. Another component is cognitive training, and this addresses potential cognitive decline associated with MS. And there are a lot of apps that you can use for cognition and also speech and language. But you can also go to an occupational therapist or a cognitive behavioral therapist. Those are typically the two best therapists that you can go to that can help you with cognition and also fatigue management, which is another component of prehab. And fatigue management refers more so to energy conservation. So, certain techniques you can do to conserve your energy, but also having a plan of attack of what exercises you can do to maintain your energy or exercises that you can do during high fatigue days. Because with multiple sclerosis, fatigue, I don't want to say it's inevitable because it's not, but it's one of the most common symptoms of MS. And if you don't know any exercises you can do on those high fatigue days, you might feel like you're stuck, like there's nothing that you can do and you have to wait until you have energy in order to exercise. But that's not actually true. So prehab can teach you exercises that you can do during those fatigue days and as a way to manage fatigue. Another component of prehab, especially in multiple sclerosis, is stress management. In all people, stress typically causes a fight or flight response. And when you have MS, that fight or flight response can cause an increase in inflammation, which can cause temporary worsening of symptoms. So having a plan of attack to reduce any stress or most stresses can be an extremely helpful part of prehab. And of course, everyone's prehab program is going to look different because MS is different for each person. And not only that, MS is different for the same person each day and sometimes even hour by hour. So it's important to work with a physical therapist or possibly an occupational therapist that can help you determine these components. So what exercises are going to be best for you? What cognitive training could you start doing now? Or what speech training could you start doing now? What strategies can you use to manage fatigue? What strategies can you do to manage stress? And not only that, but what exercises and strategies could you do on different days? On a day where you have lots of energy, but also on a day where you don't have a lot of energy. One way to know if your prehab is helping is by tracking your progress. And I actually have a podcast episode on this. It's episode number 111. And I talk about ways that you can track your progress at home. And that's going to be a really helpful component for someone who maybe is a little competitive with yourself, but also someone who needs to see numbers. You need to see that what you're doing is actually making a difference. And there are ways to track your strength, your walking, your fatigue, and balance, and so much more. So check out that episode if you haven't already. But if you are going into a physical therapy clinic or occupational therapy clinic, they are someone who can evaluate and assess your current level of balance, strength, walking, etc., and give you these prehab exercises and tools and strategies, and then also design a program for you to do at home. Prehab doesn't always need to be done in a physical therapy clinic. You can use that therapist to help design a program for you, and then you do it at home if you're able to stay consistent and accountable. And as exercises get easier, your therapist can hopefully make them more challenging for you or upgrade your program so that it's a more difficult exercise. So doing prehab with a PT can be really beneficial so that it's not just the same program for years and years or months and months. It adapts with you. It gets harder when you need it to be harder. It gets easier when you need it to be easier. And this concept of prehab can also be used during unexpected times, like if you get the cold or the flu. And I just want to share a quick story with you of one of my patients that I was working with. And we didn't even really know that we were doing prehab at the time, but it became glaringly obvious at a specific time in his journey. So he started seeing me. He was a patient with multiple sclerosis, and he started working with me because he wanted to maintain but also improve his walking. He had started noticing that he was tripping more and scuffing his toes more often, more foot drop, a little bit of difficulty bending his knee, a little bit more off balance. So all things that affect his walking. He was still able to walk without a mobility aid, but he didn't feel safe doing that. So he was coming to physical therapy. We were doing lots of exercises, and he was actually noticing pretty quick improvements. I would say within 2 or 3 months, he was already walking much better and feeling more stable and safe with walking. And then he got the flu. And if you don't know this, I hate to be the bearer of bad news, but sometimes, not all the time, sometimes the flu or a cold or any infection can really knock you on your butt. It can really affect your MS. So he went from one day being very happy and confident with his walking to now having the flu and not being able to get out of bed. It affected everything for him. He was in bed all day. He wasn't doing his exercises. He wasn't walking. He couldn't do anything. So then when he did try to walk, it was so much worse. It was more unbalanced. His knees were hyperextending and buckling and giving way, and he wasn't happy with it. And he couldn't even come to physical therapy. So he called me. He says, Dr. Gretchen, I've got the flu. This is awful. I went from being happy with my walking to now not even being able to walk. What do I do? And so we went back to basics, and I chose just one exercise from the plan that he was doing. And I said, do this one exercise, even just a few repetitions a day, maybe not even every day, just whenever you can, and start there. And so he did that for a few weeks. And then eventually he called me again. He's like, okay, I'm doing that. I'm feeling a little better. What else can I do? And so I added on a second exercise and then a third exercise. And it was so little where normally he probably would have thought, what's the point in doing this? Like, this is such little exercise. It's not going to make a difference. But he trusted me and he did it anyways. And long story short, after several months, so it did take time for him to get back. But after several months of doing that, he was slowly able to work back up to his program, and he was able to walk again, feeling stable without a mobility aid. And as I mentioned in the beginning of this story, we didn't realize it at the time because we couldn't have predicted that he was going to get the flu. But I'm a firm believer that all of the exercises that he was doing before getting the flu absolutely helped him recover faster and helped him get back to the place that he was before the flu. Had he not been strengthening and working on balance and walking before the flu, he would have been at the point of his walking where he was still feeling unstable and uneven. Then he would get the flu, and he probably wouldn't have been able to recover, at least not as quickly afterwards. So prehab is an amazing concept because it basically prepares us for anything that were to come that could possibly cause a decline. And it can help reduce the severity of the decline and also improve the duration that it takes to recover from a decline. The majority of the exercises that I would prescribe as prehab are exercises that I give almost every patient and client that I work with, because even though MS tends to be different for every single person, it also tends to attack specific muscle groups like the hip flexors, the knee flexors, ankle dorsiflexors, the core. And so knowing that MS tends to attack those areas, we can do prehab on those areas. And all of my favorite exercises for all those areas are inside my online wellness program, The Missing Link. If you're not a member of The Missing Link, I will put a link in the show notes where you can learn more about it. But the big thing to know about prehab is start now. It's never too early to start prehab, and it's never too late to start prehab. So start now, learn what exercises you should be doing to help maintain and ideally improve before a possible relapse or progression. And the last thing I guess I want to mention on this topic is I would encourage you to view this with a positive mindset, of a proactive mindset, not with the mindset of, oh, great, I'm doing this because this might happen, this decline might happen. Think of it more so as preparation. And this is true even if you didn't have MS. None of us know if we're going to fall off of a curb and break something and then we need surgery, or break something and then we can't use our leg for a while and then we need to heal and recover from it. None of us know what the next day is going to bring, especially with MS, but even without MS. So prehab is just a way of living, a mindset and practice to help prepare you to be as strong as you can be. And I would encourage you to view it that way versus viewing it as a depressing mindset, because it can easily turn into that, if I'm being honest. So I hope this helps you understand what prehab is. If you are looking for prehab exercises for MS, again, all that is inside my online program, The Missing Link. So check the link in the show notes and you can learn more about it there. Thank you.